Welcome to the 3-Minute Read podcast. I'm John Dalton, editor of the twice-monthly newsletter of the Healing American Healthcare Coalition. Once or twice a year, we actually publish a third issue, and we'll be discussing January's third issue today. Joining me once again is Ed Eichhorn, the coalition's co-founder and co-author of Healing American Healthcare, a plan to provide quality care to all while saving $1 trillion a year. Together, Ed and I have nearly a century of healthcare experience, and believe me, we're still trying to figure it out. You can find our background and contact information at the end of the podcast. Ed and I launched the 3-Minute Read last March to summarize some of the critical issues affecting busy clinicians and physicians as they struggle through this pandemic. To date, we've covered 111 articles from 50 different sources on a variety of topics, including physician practices, insurance coverage, and drug costs, and, of course, the pandemic. January 20th, 2021 was the one-year anniversary of the first COVID-19 case confirmed in Washington state. It was a traveler returning from Wuhan province in China. With more than 400,000 American deaths from the pandemic, President Joe Biden took office in Washington, D.C. on January 20th and launched an all-out assault on the coronavirus. Our first 3 article summaries deal with President Biden's initial actions on COVID-19, so let's dig into the latest issue of 3-Minute Read. The first article was entitled, Biden Looks to Galvanize COVID-19 Fight and Vaccinations as He Takes Office. It was from Reuters and was published on January 20th, Inauguration Day. During his inaugural address, after taking the oath of office, President Biden asked for a moment of silence in memory of the more than 400,000 Americans who had perished in the pandemic. He then stated, quote, in his address, "We're entering what may be the toughest and deadliest period of the virus and must set aside politics and finally face this pandemic as one nation." Following his inauguration, he moved to the Oval Office where he signed his first 3 executive orders. 1, requiring masks to be worn on federal property. 2, rejoining the World Health Organization. And 3rd, establishing a new White House office for coordinating the response to the virus, and led by Jeff Zients. The federal mask mandate drew praise from the U.S. Chamber of Commerce. President Suzanne Clark called it, quote, a smart and practical approach. UN Secretary General Antonio Guterres also welcomed the re-engagement of the United States with the World Health Organization. Another UN spokesman said it was absolutely critical for a better coordinated global response against COVID-19, basically to have the United States back involved again. Next up, on Thursday, from the Associated Press, talking about Biden signing a burst of virus orders and vowing that, quote, help is on the way. Next, on Friday, the New York Times summarized what's in Biden's executive orders aimed at curbing the pandemic. Let's take a look at them. He signed 10 more executive orders aimed at jumpstarting the national COVID-19 strategy. That was a 200-page document that was also revealed on his first full day in office. He's giving government agencies a green light to use the Defense Production Act. That's a Cold War era act of Congress. That act allows the government to direct private industry to produce supplies needed in times of national emergency. So, for example, in this case, it could be anything from swabs to masks to certain chemicals and reagents used in testing. White House Coronavirus Coordinator Jeff Zients says, quote, we do not have nearly enough testing capacity in this country, and that's one of the issues that he will be addressing. Others, the federal mandate that requires mask wearing during travel that crosses state lines. So whether it's planes, trains, or automobiles, if you're crossing state lines, you must wear a mask. When it comes to international travel, the transportation TSA will be enforcing the mandate. He also looked to expand the nation's supply of rapid tests, establishing a pandemic testing board, wants to double testing supplies and increase lab space for tests and surveillance for coronavirus hotspots. In expanding vaccine availability, Biden has established a goal of 100 million shots in the first 100 days in office. That was announced on January 8th. To some skepticism, because remember, the Trump administration had promised 20 million shots in the arms by the end of December. And actually, by January 19th, the day before the inauguration, The total of vaccine shots administered was 16.5 million, far less than the 20 million promised by the end of December. We also established a health equity task force to identify the parts of the population who are particularly hard hit by the virus, analyzing needs by race, ethnicity, geography, and disability, among other factors. He directed his agencies to publish guidance for safely reopening schools and for protecting the health of workers. At his press conference on that Thursday, a reporter questioned whether the 100 million shots in his first 100 days was too low a bar. Biden's response was, quote, "When I announced it, you all said it's not possible. Come on, give me a break, man." Dr. Fauci at that same conference commented that if we hit that mark, the U.S. could return to, quote, "a degree of normality by the fall if the vaccination campaign goes well." We'll have an update on that later. But achieving widespread herd immunity would require vaccinating as many as 280 million people. Our total population is around 330 million in America. The issue to protect the health of workers during the pandemic is an important one. I think we all can remember that the Occupational Safety and Hazard Administration kind of fell asleep at the switch back last spring when meatpacking plants workers were coming down with COVID-19, and many of those workers died. So that is a particularly important executive order. Finally, find more treatments for COVID-19 and future pandemic. He's calling on the Health and Human Services Secretary and the Director of the National Institutes of Health to draft a plan to support the study of new drugs for COVID-19 for treatment for future public health crises through large randomized trials. The treatments should be ones that, quote, "can be easily manufactured, distributed, and administered, both domestically and internationally," end quote, according to that executive order. So we've declared war on COVID-19 virus. We're now 15 days into the Biden administration. Ed, what do you have in terms of updates?
Well, the vaccinations have been going reasonably well recently. As of February 4th, 36 million, almost 37 million Americans have received at least one vaccination, and 57 million doses have been distributed in the United States. Earlier this week, J&J applied to the FDA for emergency utilization of their vaccine, and approval is expected by February 28th. If that occurs, this vaccination could begin being distributed during the first week in March. ABC News reported this morning that they would have 100 million doses available by the beginning of June. Other sources have suggested they could have as many as 200 million doses available early in May. This is very significant because the J&J vaccine needs to be stored in regular refrigeration rather than in a freezer, and only one dose is required for development of immunity. There are other promising vaccines on the horizon. Novavax was retained by the United States to develop a vaccine at the cost of $1.6 billion in the middle of last year. And they have done trials in Great Britain, Brazil, and South Africa, which yielded good immunity against some very difficult conditions. They have now retained 20,000 volunteers in the United States and expect to have a full complement of 30,000 by the end of March, and hope to apply by the end of April or the beginning of May for emergency utilization. And they believe that they can have as many as 300 million doses available by the end of June. Today it was announced by Dr. Fauci that he expects approval for using the vaccines for students from the age of 12 to 18 in the United States in late May or early June. Back to you.
So lots of good news on the vaccine front. In fact, one that we probably never will see here in the U.S., Russia's Sputnik V vaccine apparently also is highly effective. The Russians actually started vaccinating before their clinical trials were through, and there was a lot of skepticism at that time about premature issuance of the vaccines, but apparently they must have had a fair amount of confidence in the vaccine, and now the latest reports is that it is effective and they are exporting it to their member states, including most recently Iran. Next up, the U.S. needs more COVID testing, and Minnesota has found a way. This was a major story in Bloomberg Business Week in the January 11th issue. It's a very lengthy and detailed enumeration of how Minnesota stepped up its testing. You're starting with a state that's not necessarily our biggest or our wealthiest, but with a progressive governor and a budget surplus, they were able to invest about $150 million in expanding their testing capability. And that included a major ramp up of a saliva test that was developed here in New Jersey at Rutgers University last spring. They're one of the few states in the country that's adopted the kind of approach that Hong Kong, South Korea, and Taiwan took to avoid the worst of the pandemic's ruin. What their governor, Tim Walz, said, quote, it was a catastrophic failure on the federal level, talking about the U.S. approach to testing. So Minnesota had begun their testing with the nasal PCR swabs, and they were able to ramp that up to about 10,000 tests a day. They determined that they needed to have a lot more testing done because their numbers were looking pretty dismal in the fall. Again, Minnesota's not that far away from Sturgis, South Dakota, where that motorcycle rally created a super spreader event. So what they did was to ramp up testing using the Rutgers test. Infinity Biologics is the company that evolved from the Rutgers spit test last June. Their Oakdale lab, located about 10 miles from downtown St. Paul, is the center of what they implemented last fall to increase their testing capability. Importantly, it's located right next door to a United Parcel Service depot. And they currently are receiving about 4 deliveries daily from UPS and processing about 30,000 tests per day with the results available within 48 hours. So it's a major expansion from the nasal PCR tests. Now, according to the FDA, the saliva tests are as sensitive and accurate as the nasal PCR tests, but they're much easier to administer. The kits can be sent to people's homes, and even when they're administered at testing sites, collecting saliva samples requires fewer medical professionals and less personal protective equipment than using nasal or throat swabs. So it's a more efficient and effective way of getting samples for testing. Spitting into a tube is more comfortable than being swabbed, although the recommendation is that you smell pickles before you spit into a tube because it does require a fair amount of saliva. You can eat the pickles later. When neighboring North Dakota and South Dakota were showing the highest positivity rates in the nation, Minnesota ranked 21st. So Governor Walz's conclusion was that their strategy, yeah, you betcha, it was effective. Next up on the vaccination front is Country Roads. Little old West Virginia sets the pace on vaccine rollout. That was an Associated Press article that appeared on January 19th, the day before inauguration. What did West Virginia do? They initially rejected the federal partnership with CVS and Walgreens because they thought the rollout would be too slow. They were correct on that score. And instead, they relied on their mom and pop pharmacies to vaccinate residents, under the theory that, in rural West Virginia, the local pharmacist is not only a source for medical information, it's part of our friends and family. So 250 of their local pharmacists set up clinics in these rural communities. And as a result, the Mountaineer State was the first in the nation to finish offering first doses to nursing home residents by the end of December. They got those shots in the arms. And they currently lead the U.S. in per capita vaccination rates, followed closely by, guess where? Alaska. So Republican Governor Jim Justice proclaimed that, quote, little old West Virginia that was thought for 100 years, as a place where maybe we were backward or dark or dingy. Turns out that, quote, West Virginia has been the diamond in the rough. He said that on Face the Nation a couple of weeks ago. So, given concerns about vaccine safety, the American Pharmacists Association attested to West Virginia saying, quote, having access to a healthcare provider like a community pharmacist provides the comfort levels for patients and communities. And West Virginia certainly is an example of that working very, very well. Ed, any comments on the testing and vaccine successes?
Actually, the comment that I'm going to make here goes to the issues of testing that you discussed on the previous slide. One of the important aspects for the mitigation strategy is to increase testing, as has occurred in Minnesota. And it's important to realize that physicians are also trying to support more testing. And some of them have bought the equipment that's needed for the saliva test that John mentioned that was developed in Rutgers. However, the reimbursement for that provided by most insurance companies is approximately $21. The cost for the reagents for each test is $42. So there needs to be an adjustment about how this is reimbursed for tests done in the physician office. Another logical place to do this testing, because a patient might come in with symptoms, have the saliva test, and before they leave the office, they would know whether or not they had the virus. So there needs to be some updating of fee schedules so that physicians actually are reimbursed for the services they provide when they do this test in their office.
Okay, next up is our final article, and it's the Shkreli Awards Shames Healthcare Profiteers that appeared on MedPage today on January 6th. And as you can see from the icon, it's a cracked trophy cup for the award for a very good reason. The Shkreli Awards were named for entrepreneur Martin Shkreli, who acquired the company that made generic drug Daraprim, which is the only known cure for toxoplasmosis. And after acquiring the generic drug, he raised the price from $13.50 to $750 per pill. The Lown Institute began 4 years ago issuing what they call the Shkreli Awards, and it's kind of like being elected to the Hall of Shame. So we'll cover the top 3 awards, but they award 10 awards each year, and just like to talk about 2 that aren't on our slide today. 5th place was given to pharmaceutical giants AstraZeneca, GlaxoSmithKline, Pfizer, and Johnson & Johnson, because they refused to share intellectual property on COVID-19, instead deciding to, quote, compete for their profits instead. The technology access pool would have made participants' discoveries openly available to more easily develop and distribute coronavirus treatments, vaccines, and diagnostics. So Dr. Don Berwick, who is the founder of the Institute for Healthcare Improvement, and during the Obama administration was the minister of the Centers for Medicare and Medicaid Services, said, quote, what would it be like if we were in a world in which a company like Pfizer or Moderna or the next company that develops a really great breakthrough says on behalf of the well-being of the human race, we will make this intellectual property available to anyone who wants it. That's the way things should work. But in this case, the 4 big pharma companies decided, no, we're going to keep it to ourselves. In 7th place, the Lown Institute called out hospitals that punished clinicians for, quote, scaring the public, suspending or firing them because they, quote, insisted on wearing N95 masks and other protective equipment in the hospital. So hospitals who fired or threatened to fire clinicians for speaking out on COVID-19 safety issues were called out for their behavior. And I think Ed and I can both recall times here when Metro New York was in a crisis in March and April, where some hospitals in our area were firing people for speaking out about the lack of PPE, and people were having to use N95 masks, which are supposed to be used once per patient, having to use them for an entire day. We were looking at ways to sterilize and reuse personal protective equipment. So there's 2 more in the Shkreli Hall of Shame. In 3rd place were 4 California hospital systems that refused to take COVID-19 patients or to delay transfers from hospitals that were out of beds and needed to transfer patients to hospitals that had available ICU capacity. A Wall Street Journal investigation found that these refusals or delays were generally based on the patient's ability to pay. Many of the patients were on Medicaid or were uninsured. For some reason, these 4 California health systems ignored the fact that wallet biopsies were outlawed in 1986. Congress enacted the Emergency Medical Treatment and Active Labor Act, EMTALA, to stop patient dumping, because in many parts of the country, for-profit hospitals were sending patients who were uninsured or with low reimbursement to their public hospitals in various hospital districts. So wallet biopsies were outlawed in 1986. These 4 California hospital systems seem to forget that, and I understand that several of them are being investigated by the California Attorney General's office. In 2nd place, vaccine maker Moderna one of the heroes of Operation Warp Speed, which set a price of $32 to $37 per dose for its double-dose vaccine. That's more than the U.S. agreed to pay for other COVID vaccines, including the one from Pfizer, which is also a messenger RNA based. Now, let's face it, Moderna received almost $1 billion in federal funding to accelerate the process of developing its vaccine. And who did they work with on it? The scientists at the Federal National Institutes of Health. Reminds me of the 1987 film Wall Street, which starred Michael Douglas as Gordon Gekko. And if you remember the key phrase from that, quote, "Greed is good," end quotes. Greed is not good. We American taxpayers funded Moderna's research, gave them the best and the brightest from the National Institutes of Health to work with, and they set a price which was double Pfizer's. First place goes to Jared Kushner and the federal government's Project Airbridge, quote, to airlift PPE from overseas and bring it to the U.S. quickly. It did bring some personal protective equipment to the U.S. very quickly, but instead of getting it to the hotspots, the PPE was distributed to 6 private medical supply companies who then sold it to the highest bidder. And that created a bidding war among the states. We can all remember the crisis here in the metro New York area when PPE was unavailable or in scarce supply, and we had people actually sewing masks at home, and a lot of businesses converted their equipment to be able to make the face shields that clinicians had to wear in treating patients. Many of our hospitals found creative ways to stretch their scarce supplies of personal protective equipment, but it was a major crisis. However, what the Project Airbridge did was to create a bidding war among the states for PPE. Interviews with the 10 hardest hit counties revealed that they received no PPE from Project Airbridge. So shame on Jared Kushner and Project Airbridge. They took first place in the Hall of Shame Awards. Next up, we're interested in your thoughts. Ed?
At the Coalition, we'd like to know your thoughts about the future of healthcare in America. And we have a brief survey that we would ask you to take. It's completely confidential, takes 2 or 3 minutes to complete, and gives us information about the coverage that we all have in private health insurance or with Medicare or Medicaid. And if you take the survey, you can have 2 options. You can receive our newsletter, the 3-minute read, at no cost to yourself for 3 months. And in addition to that, if you'd like to learn more about the survey, as you take it, you can request a copy of the final report. The survey will be active and live between now and the end of April, and a report will be available by the middle of May. So we'd really appreciate it if you would consider taking our survey and helping us to understand some of the variables in health insurance coverage. And in future podcasts, we'll certainly give you feedback about this study, and we'll also be talking about universal health care versus Medicare for all. Now, in the early responses to our survey, we've gotten questions from people who have participated asking or saying to us, universal health care, that's socialized medicine. I don't want that. And universal health care does not have to be socialized medicine. Medicare for all is a single payer system that is a socialized medicine model, and we don't advocate for that. We advocate for the plan that we wrote in our book, Healing American Healthcare, and that's the Eichhorn-Hutchinson All-Care Plan, which is actually a very capitalistic-oriented plan that provides choice for employers and for individuals. And you can certainly read about it in our book, but we'll be covering it in future podcasts. So thanks today. We appreciate your being with us. And if there's anything you'd like us to look into, discover, write about, well, let us know. Contact us, and we'd be happy to follow up with you and bring that to the 3-minute read.
And here's the contact information for Ed and for me. And if you would like to join the mailing list, text HEAL Healthcare to 22828 to get started. And meantime, until the next podcast, wash your hands, watch your distance, and wear a mask. Thank you.